let's move on to the sort of the bigger picture, the sort of longer term. That this is the kind of early challenges Labour will face, but then you've sort of said, okay, we need a bigger, more structural, more fundamental reform. One of these sort of interesting things I find talking to health people working in the health policy world is there's simultaneously a desire not to restructure again because we've had so many restructures over the last 20 years or so, and also a belief that you do need to do something really quite fundamentally different to what we're doing at the moment in order to sort of deliver on this promise of moving towards more preventative care and so on. How do you square those two things? How do you get a fundamental change without changing the structures that we're operating in?
No, I think it's a really good point. So the reason people don't want to restructure is that it is a weapon of mass distraction, and we know what happened with the land survey reforms. I'm old enough to remember Frank Dobson coming in and ripping up GP fund holding when probably it would have been better simply to have reformed it, adjusted it in various ways. It didn't need to be pulled up by the roots. So then I think Labour promised in '97 to abolish the internal market, and then obviously recreated an even more kind of a marketized system a few years later. So it's important that we don't have a reorganisation for organisation's sake. But the two things that we have got to address is firstly, what do we do about the health of the population? The kind of point that Chris Whitty will make is if we are not able to keep people healthier for longer, as our health service is simply not sustainable. And keeping people healthier for longer does require action in the health service, but it also requires action in all sorts of other domains. And so this goes to Labour's idea of a mission, a broader approach to health. Only estimated around 20% of our health outcomes are a reflection of our interactions with the health service. The other 80% is a combination of genetics, but then also what I call the social determinants of health, poverty and housing and environment, and then lifestyle, smoking, alcohol, food, gambling, etc. So first of all, we need a health policy, not just an NHS policy, and that health policy needs to be really firmly focused on how do we improve the nation's health and how do we keep people healthier for longer. And then the second thing we have to do is something we've been talking about for decades and actually done the reverse. And that is, for decades, we've been saying we need to move resources proportionately out of the acute sector and upstream into primary, into care based in the community, into secondary prevention. But actually what we've done over the last few years is increase the resource going into acute. We've got fewer full-time equivalent GPs and we've got an awful lot more. Well, I don't need to tell you this. I mean, you've written about it very eloquently. We've got more people, more doctors in hospitals. So those are the two things we've got to try to find a way through. And it's not, I know that when I talk about this stuff, people go, oh God, there's your kind of lefty think tank. It's all very abstract. It really isn't abstract. If we do not do something to get people to live longer, healthier lives, and we don't do something to shift the pattern of investment in the health service, then we are going to end up in a situation where the health service just consumes, more and more of public spending and more of the workforce.
So, in terms of trying to develop like a proper health service as opposed to a sickness service, which it feels like we've got at the moment. I mean, I totally agree with joining up the dots, but that work is really time consuming. It's not the kind of sexy end of politics. It takes quite a long time to sort of see developments on that. How would you get that to work in real life from a sort of government delivery point of view? Is that something that needs to be driven from the centre? Does there need to be some sort of coordinating, kind of cross-cutting cabinet group? How does this work in real life?
Yeah, again, really interesting and lots of bits to that. I mean, I think one problem about the election being called early is that I think that Labour was really starting to focus on this question of mission delivery, and it's kind of had the rug pulled out from under its feet in terms of its preparedness for that. So I suspect that thinking through what mission-driven government is going to be something that's going to be a priority for Labour, and I'm certainly sure that civil servants are doing a lot of thinking about how that works. And there's a lot of evidence from around the world around this kind of mission-driven government, and it's not easy. There are examples, there are areas where it has been done, and probably the environmental agenda, the green agenda, is where it's been most often done in other countries. So there are things to be learned there. So that there is going to, it's going to be a lot of work that has to be done on how you make that work. But then more specifically, I guess I'd say two things. One is, let's not be too pessimistic about this. We reduced teenage pregnancy by a half. We have reduced the prevalence of smoking by, I don't know what the figures are, but from over 50% to less than 15%. We took lead out of petrol pretty quickly. There are things that we can do that will have relatively quick feedbacks if we decide that. So I think a government that was really concerted in its determination to tackle obesity and had a 10-year plan which encompassed everything from the regulation of food products through to investment in fitness, in schools, all sorts of stuff, and actually using the new drugs that are coming along, which will make a difference as well. I really do think you can make an impact. So it's partly about focus. And then finally, I think in terms of the health service, it's just being clear where the easy wins are. Areas like vaccination, like the diagnosis and treatment of cardiovascular disease, where a more concerted national approach. I think vaccination, it saves £24 for every pound that's spent on vaccination. So there are some areas where it's just obvious that if you could invest more reasonably quickly, it would have a relatively quick feedback loop.